The left lobe of the liver is gently lifted using a Nathanson retractor to provide clear exposure of the surgical area.
The pars flaccida is open to gain access to the lesser sac and the right cruce of the diaphragm. The anterior peritoneum is being incised to expose the underlying structures.
An endotape is placed around the lower esophagus to provide controlled traction and facilitate safe manipulation. The esophagus is being dissected into the mediastinum to achieve proper mobilization. A myotomy is now performed by carefully dividing the muscle fibers of the lower esophagus in a longitudinal direction. The incision is extended approximately 6 centimeters proximally along the esophagus and about 2 to 3 centimeters onto the stomach. This helps relieve the tightness at the lower esophageal sphincter, allowing food and liquids to pass smoothly into the stomach. In this view, we can clearly see the anatomical structures, the right cruce and left cruce of the diaphragm forming the esophageal hiatus, through which the esophagus passes. The lower end of the esophagus and the upper part of the stomach are also well visualized. This area is being prepared for cruroplasty, which involves approximating the right and left crura to restore the normal anatomy and prevent hiatal herniation. Here, the fundus of the stomach is being mobilized to construct the toupet fundoplication, a 270-degree posterior partial wrap around the lower esophagus. This technique helps reinforce the lower esophageal sphincter while maintaining the ability to swallow normally. The posterior aspect of the esophagus is gently cleared, allowing the fundus to pass behind it for creating the partial wrap. Now, the toupet fundoplication is being constructed. The gastric fundus is positioned behind the esophagus and partially wrapped around it, covering approximately 270 degrees of its circumference. This posterior partial wrap provides effective control of reflux while preserving normal swallowing and belching functions. The sutures are carefully placed to secure the wrap without causing any tension or obstruction.